TV. We're here today with Dr. Michael Wald, Doctor of Nutrition and Director of Nutritional Services at Integrated Medicine of Mount Kisco, PC. Our topic is nutrition. As a doctor of nutrition, what is the most important nutritional habit that a person should upkeep in order to remain healthy?
Well, probably the most important habit that one should routinely do, which is the definition of a habit, is to eat as low down on the food chain as possible. In other words, fruits, vegetables, nuts, seeds, and grains are foods low down on the food chain. They haven't bioaccumulated nearly as many toxins. And studies of different communities and people that consume higher amounts of foods lower down on the food chain tend to live longer with less disease by not dying prematurely from the chronic degenerative diseases that are so common in those that eat higher up on the food chain, which basically means more red meat and also refined and processed foods, including white flour and sugar. So that's the number one pick. Think lower down on the food chain. Think vegan or vegetarian. You don't have to be a vegan or vegetarian, but if you think about those food choices and at least gravitate toward them, a person should be much better off in terms of longevity and quality of life.
Can nutrition be used beyond the basic value of being healthy? Can it be used as treatment as well as a preventative measure?
Yeah, there are more than enough examples in traditional medicine as well as alternative medicine and in scientific journals that clearly show that nutrients in the form of added, vitamin pills or powders or capsules do add to treatment. So, for example, if someone was unable to eat in a hospital setting, let's say with cancer, they certainly would give them nutrition in the form of what's known as TPN nutrition or enteric nutrition, where they put nutrition right in the stomach. So obviously, if one doesn't eat, one gets disease. If one eats concentrated forms of supplements, you could help enhance healing in ways that diet alone could not help. So, for example, if someone has osteoporosis, no doctor in their right mind would ever say to a patient, and just eat more foods with calcium. They would say that, but they'd also say, and you need between 1,500 or 2,000 milligrams of calcium pills per day. If someone's iron anemic, they wouldn't necessarily only say, eat foods high in iron. They might say, depending on how severe the iron anemia is, take pills of iron. Or vitamin D, as in some of the other examples. If someone has high cholesterol, they would take more niacin or B3, or perhaps vitamin E. If someone's receiving chemotherapy and they have peripheral neuropathy or nerve damage from chemo, they might take more vitamin E as well as CoQ10 and fish oils. So again, the list goes on of examples of how nutritional supplements beyond diet help the treatment and also prevention of a variety of diseases.
What is meant by nutritional synergism?
Nutritional synergism is a term that simply means different nutrients or nutrients in terms of supplements and foods work well together. So nutritional synergism would be, for example, taking a vitamin D capsule along with healthy fat foods like avocados or walnuts, because fats in the diet would help the body absorb fat-soluble nutrient pills like vitamin D much better. So there are many examples in healthcare of synergism, and clinicians and nutritionists that know and appreciate nutritional synergism will always tell their patients about how to best combine or not combine certain foods and nutrients appropriately.
When can nutritional synergism perhaps become detrimental to a person's health?
Well, I'm not sure that nutritional synergism itself could become detrimental unless it's not paid attention to or not capitalized on. As I said, if one wants to maximally absorb their vitamin D, they'll have a better chance of doing that if they take it with fatty, healthy fat foods in the diet. So if one were unaware of that, that might turn out to be detrimental. But there are negative interactions between certain drugs, for example, or foods and supplements that could be quite harmful. I'll give you a very common example. Grapefruits contain a chemical called naringenin, which can negatively interfere with a variety of drugs and nutrients. So if one is to take certain prescription drugs or wants to maximize their use of certain nutrients, but they're also taking large amounts of grapefruit juice or eating many grapefruits, they would significantly affect how their body uses that drug or nutrient. So again, there are many examples in healthcare of negative synergism, which is really called antagonism. That's not a good thing.
This has been Dr. Michael Wald.